Hi everyone, my name is Cecilia and I work on the helpline for OCD Action. I also manage the information development for the website. So in today's talk, I'm basically going to be covering those two things. Firstly, I'll tell you about the helpline and email service, so what support we offer, how the service works, and how to get in touch with us. I'll also go into a little bit more detail about our team and the training that the helpline volunteers go through in order to provide the in-depth information and support that they do. We are mainly an information line, so the majority of this session will be focused on the information we provide and how this can help you get what you need. I'll show you the fact sheets and useful information and documents that you can find on our website, which the helpline can take you through or answer any questions about. And I'll then go into a bit more depth on three of the main topics that we cover and what resources are at your disposal to access the right support. The first of these is the treatment guidelines. These are usually the most helpful resource that you have available to you, and they are the main source of our information. I'll then also explain how the NHS mental health system is structured to provide the right level of treatment depending on a person's needs. And lastly, we will look at the Equality Act and what rights and protections people with obsessive compulsive conditions and their loved ones have through it. So we'll start with the helpline. Many of you know about the helpline already and may have also used it in the past. The service has been running for over 20 years, and in that time it's really grown to become a major source of in-depth information and support for the OCD community as a whole. So we are here for anyone who is struggling with OCD or a related condition, as well as loved ones or even professionals looking for guidance around next steps. I tend to describe the helpline as a listening and information service. Our goal is to help anyone impacted by OCD, both to better understand what they're experiencing and their options for moving forward. The listening element of the service is also a really, really crucial one. We know how confusing, isolating, scary having OCD or a related condition can be, and that talking about it can be embarrassing or, depending on what the fears are, even kind of really worrying. Many of the people that we speak to have never told anyone about what they're experiencing, or they might have told someone, even a professional, and have not had a great reaction. Alongside providing everyone with the information that will help them work towards recovery, we also offer all of our callers and the people who email us an understanding and non-judgmental space to talk about what they're experiencing and how they're feeling. If the person then is finding that talking about this is particularly helpful, we can also signpost them to the charity's support groups where they can have a more regular space that's all about, talking support. But the bulk of the support that we offer is then in providing in-depth and personalised information about what support is available. I will cover all of our information in more detail in a little bit, but as you can imagine, it's quite varied. Many of the people we speak to haven't even had it explained to them how the condition works or what help is out there, so that's usually our starting point. Our knowledge, though, has to extend beyond just OCD and the treatments for it, so we also cover the systems through which you can access support, both within the NHS and in terms of sometimes social care or disability rights and support. And depending on the person's situation, we will go through stuff about the NHS system, their rights, how to ensure they're getting good quality treatment, how to support someone in their life. So the support that we give is very individualized, and we're there for kind of every side that the OCD is impacting on. After someone has first gotten in touch with us, we will go through with them what their options and next steps are for achieving their goals, and we'll send them any relevant information for this. We then also encourage them to keep in touch if they want, and more importantly, to come back to us if anything isn't going as it should. We aren't advocates or medical professionals, so we can't give personal medical advice or offer representation, but we can help the person to keep pushing towards what they're entitled to by providing detailed information and advocacy tips. We often say that a lot of the time getting the right help is about knowing what you're entitled to and how to ask for it, and that is where our specialty lies, really. There's a few different ways to contact the helpline for support. You can call us on 0300 636 5478. Most of the time you'll be asked to leave a voicemail, and we will always call you back if you ask us to. If we call back at a time that a person isn't available, we will try again, and everyone will have at least 3 calls from us before we stop trying. You can also email us on support@ocdaction.org.uk, or you can fill out a contact request form for either an email or a call on our website. The link for the forms and our contact details are also below this video. We generally respond to calls and emails within a week or less, but sometimes the wait can be a bit longer if we're particularly busy. In order to provide the best information as well as a safe and understanding space to talk, every member of the helpline team goes through a really in-depth training process. The helpline has 2 part-time members of staff, a manager and an assistant, which is me. And both of us work very closely with the volunteer team, which currently has 19 people on it. Most of our volunteers are personally affected by OCD, and many of them have loved ones who are as well. Every volunteer and member of staff will go through an intensive 2-day training that covers both the information we provide and how to work on the helpline. So volunteers are trained in listening skills, confidentiality, and safeguarding on the helpline. And also importantly, the training covers how OCD works and the infinite ways in which it can present, so that all volunteers can ensure that they are able to understand and help whoever they're speaking to. It also goes in depth into the related conditions such as body dysmorphic disorder, body-focused repetitive behaviours like trichotillomania or dermatillomania, and hoarding disorder as well. Then, after the introductory training, volunteers will go through an 8-week program through which they integrate everything that was covered within the original training. So each week, a volunteer will go through a shadowing shift on the helpline, in which they might listen into a helpline call, draft emails, or take some calls themselves while supervised by a member of staff. They will also then do some at-home learning every week, so that by the end of the 8 weeks, they will have read every resource that you can find on our website and have had their understanding of them assessed. Volunteers then also have ongoing supervision and training while they work on the helpline. This includes being able to contact a member of staff throughout their shift, debrief and supervision sessions after every shift, presentations from professionals, and top-up training so that they stay up to date. So, for example, over the winter, I updated most of our online resources to include new and more in-depth information. And all of the volunteers who were already on the team have now read through all of those ones so that their knowledge is keeping up to date with everything that's on our website. So now I'm briefly going to take you through the resources page on our website. This can give you a better idea of what topics we cover and just how much reading and training our amazing and dedicated volunteers go through in order to offer the absolute best support we can as a service. On the OCD Action website, you can access our resources through 2 pages. This one, titled All of Our Resources, will take you to the full list, but first we can have a look at the landing page here. So on this one, you can see the different sections of our information and click on some of the main resources in that section. You can also click Read More at the bottom here to be taken to the tab for that section in the page with all of the resources. So, for example, I'll click on Read More here in the Carers section, and the full list should open up on the equivalent tab. Yeah, as you can see here, I am a carer. This page that I've opened now is the one you would access by clicking all of the resources that I showed you earlier. On this page, you can find drop-down tabs for these same sections as in the landing page, and they include every relevant resource rather than just the main ones. You can see here that some of the resources say new next to them. All of these were published in late March this year. So if you've been through our website in the past, but not in the past few months, you might want to go have a look at what new information there is. Our informational resources are split into 6 sections. So the conditions and how they work, the treatment recommendations based on the NICE guidelines, which I'll go over in a few minutes, getting support from the NHS, supporting someone with OCD, and specifically support for carers as well and loved ones, legal rights and protections, and our advocacy tips. You can also access the various clinical guidelines. Again, I'll go over these in a few minutes, and as well as book lists and videos and link to other mental health organizations. So you can find a link to this page below the video as well, I think. An important thing to know about our resources is that all of the information in them comes from official sources so that you can rely on it when working towards your goals. Some of our resources include NHS policies such as the Constitution in England, mental health legislation, and guidance by expert clinicians. The 2 main documents we get our information from, though, are the NICE guidelines and the Equality Act. So now I'm going to talk a little bit about those and what they say you are entitled to. Some of you may have heard of NICE before. So NICE is a governmental organisation. It stands for the National Institute for Health and Care Excellence, although it's gone by slight variations of that name in the past. Their role is to publish guidelines based on evidence and research, which guide both healthcare and social care, which means social services, so support workers, that kind of thing. They've published guidelines on working in certain sectors or with certain people. So, for example, there's guidelines about supporting unpaid carers or parents during the perinatal period. All of the guidelines that NICE publishes are on their website. The guidelines for OCD and BDD are very thorough and can be the most helpful tool in accessing good quality treatment. Even though they're not legally binding, both NICE's website and case law are very clear that doctors must consult them. So if a doctor or a service decides to act differently from what the guidelines recommend, they must have a good reason, and that reason has to be supported by a reasonable body of experts. Basically, what this means is that a doctor's individual opinion is not enough to decide to go against the guidelines. The whole reason the NICE guidelines were set up was to fight against the issue of the postcode lottery in the NHS. Basically, it shouldn't matter where you are and what resources are available to the mental health team closest to you. You should be getting the same level of treatment. So the guidelines make it clear to services what is expected of them. Therefore, a service also can't get around the recommendations by saying that what they say isn't available in your area, or by saying that they do things differently there. Of course, they might still say that, and part of how we can help is by supporting you to use the guidelines to push for what you need. Technically, NICE only covers England and Wales, while Scotland and Northern Ireland have their own sets of guidelines. The thing is, though, that both Scotland and Northern Ireland haven't written their own OCD or BDD guidelines yet, so the NHS there should still be following the NICE guidelines because it's their duty to follow best practice and most up-to-date evidence, which the guidelines are. I'm sure you've all had plenty of opportunity to hear about the recommended treatments and how they work from our great clinical speakers today, so I won't go into that side of things. but it can just help to know that there are only 2 recommended treatments for OCD listed in the NICE guidelines. So these are the only things you should be offered. And if you want them, the NHS should be offering them, full stop. Now, these are cognitive behavioural therapy with exposure and response prevention, and anti-obsessional medication, which is SSRIs or a different type of tablet called clomipramine. There's also then some kind of other additions, such as, if your medication isn't quite working, other booster medications that you can try. But that's all covered in the guidelines, and more importantly, it's all covered in our information on the website in much more plain language, easier to access. The guidelines are also very clear that these treatments should be offered, and that's the only word they use there. It's never about forcing, and you can't be asked to try one treatment before being able to access another. So you can't be forced to have therapy before trying medication, or the other way around. Another great thing about the guidelines for OCD and BDD is that there are 4 different versions, which can be really helpful in different ways. Now, the version on NICE's website is the simplest one. It has a list of all the treatment guidelines plainly spelled out. It's still quite a lot, I wouldn't recommend it as just casual reading, but if you're looking for just a simple black and white, this is what should happen next, that can be a good resource for that. Then there's also the version for the public. Now, this is the one we send out the most to people after we've spoken to them on the helpline, because it is the most accessible in terms of language. It was written specifically for patients and carers, and it describes what you should expect from the NHS if you have OCD or BDD. It includes sections specifically about supporting people under 18 and supporting carers. Then there's the quick reference guideline. Now, this was written for GPs and consultants. It's mainly made up of charts and bullet points to help your doctor work out what the appropriate next step would be for you. And then finally, the full guideline, which is a very big 350-page document. It includes not only all of the specific guidelines that you can find on the website, but also lots of writing about the experiences of people with OCD, experiences of their loved ones, research that they included, what the findings were, and any kind of explanations about how they made the decisions for the specific recommendations. So just as an example, there's a section there all about assessing young people with OCD and not getting distracted by school problems or thinking that the child is going to outgrow it. So that's not written in the step-by-step simple guidelines, but it is still part of an official document, and you can quote it to a doctor who's maybe saying those things. Now, all 4 of these are official documents published by NICE, so everything in them can be quoted directly to your doctor. And you can speak to someone on the helpline or have a look at the resources on our website to find out more about how to apply all of this to your specific situation. Part of the amazing depth of the OCD and BDD guidelines is the description of the Stepscare System. Now, all of the NHS runs on this system, in which there are different levels where you can get treatment, depending on how complex your needs are and how specialised a professional you need to work with. So you've got the 3 levels: primary, secondary, and tertiary, although in our information and on the helpline, we tend to just refer to the 3rd one as specialist. Very helpfully, the guidelines for OCD and BDD go into a lot of detail about how someone should be seen within this system. Basically, the idea is that you should be sent at first to the lowest level that is appropriate, and then, if needed, you can work your way up. The treatments you would be receiving at each level would be the same ones, it's just at different levels of specialty and intensity. For many people, the starting point would be at the primary level, but someone might also be referred straight to the secondary or specialist treatment, depending on their situation. Now, this chart was taken directly from the quick reference version of the guidelines that I spoke about before, the one with all the charts for your doctor. It's written in quite a lot of clinical jargon, but you can find explanations of the different levels of treatment and who they are for on our website in the section about accessing support from the NHS. Our final topic is the other document that many of our resources are based on, which is the Equality Act 2010. This is the legislation in place to protect from all forms of discrimination. In the case of OCD, we're interested in disability discrimination specifically. Now, you might not feel like disability is the right word for you or what you're experiencing, and that's absolutely fine. No matter how you identify it, under the definition of the Equality Act, you have a right to support and protection. Under the Equality Act, a disability is defined as a condition that impacts on your ability to do normal daily tasks for a year or more of your life. Now, this doesn't have to be every day, because many conditions come with good and bad days. This also doesn't mean that you have to have been diagnosed for a year, because it also includes conditions that can be expected to last a year or more without treatment. So even if you've only had symptoms for a week, you are protected under this definition, because without treatment you would likely continue to have symptoms for, well, probably longer than a year. So to put it simply, the disability element of this legislation protects your privacy, meaning that employers, for example, can't ask you about whether you have a condition. It also protects you from different forms of discrimination, and within that gives you a legal right to flexibility and support at work, in education, and when accessing services. Under the Equality Act, there are 7 types of discrimination that you are protected from. I'll go through them using a very common and simple example of someone who's slowed down by their intrusive thoughts and compulsions, and so struggles to leave the house on time for things like work or appointments. But again, what counts as a disability or as an impairment is very fluidly defined in the Act. So everything I'm going to go through can manifest in really different ways depending on the situation. So we've got direct discrimination, which is just what it sounds. So in this example, it could be the person being fired or being denied a job because they have OCD. Indirect discrimination is when a policy or way of doing things impacts negatively on someone with a disability, even though that wasn't the intention behind putting it in place. So in this case, it might be a policy at work that people must start the day by 9 a.m, even though the work isn't being impacted if people don't. Discrimination arising from disability means being discriminated against for something that isn't the disability itself, but is there because of it. So in this example, it might be the employer saying, I don't mind that you have OCD, we're really great with mental health around here, I just don't want to hire someone who's going to be late a lot. Harassment is, again, like it sounds. It means treating someone badly because of their disability or because of something to do with their disability. So if this person's co-workers made fun of him every time he was late in the morning, that would be harassment. Victimization, on the other hand, is treating the person badly for doing something they have a right to do under the Equality Act. So if the person in this example made a discrimination claim because of something, for example, one of the things I just mentioned, and then was bullied at work afterwards, that would be victimization. Discrimination by association is actually discrimination against someone who is connected to a disabled person. So if a parent was being discriminated against because of their child's disability, or in this example, if a co-worker helped out with making that discrimination claim that I mentioned, and then the co-worker was bullied for it, that would be discrimination by association. And finally, and probably of most interest, is discrimination through failing to make reasonable adjustments, or a probably simpler way of putting it is your legal right to reasonable adjustments. And this is where you can be really most active in making sure that you are getting the flexibility and support you need, again, from employers, education providers, and when accessing services. So that can mean accessing treatment from the NHS, it can mean your private landlord, it can mean your local authority, basically anyone who's offering you a service also has a legal duty to consider and put in place reasonable adjustments. So what is that? An adjustment is a change that's made to make up for the obstacles put in place by the disability. So in the example we have, the person could ask to have a flexible starting time. So if I come in a half hour later than 9, I leave a half hour later than I'm supposed to. Now, whether this adjustment is reasonable or not depends on the individual case of, I guess, what his work is. So if it's the kind of work that won't be impacted as long as you're doing your hours, then the employer would have a legal duty to put this in place because there is no reason that it's unreasonable. Whereas if it was a job where one person coming in late then causes a chain reaction and everyone is slowed down massively for the whole day, that might not be a situation in which that reasonable adjustment can be put in place. But the employer still has a duty to explore what could be put in place that would be reasonable. And so that brings us to the end of this presentation. Thank you very much, everyone, for coming along and watching. I hope the information I covered was useful and was a good introduction to the fact that you are entitled to support and that there are guidelines in place there to help you access what it is that you need. So if there's anything we can do to help you out, whether that's talk you through any of this in any more detail or help you figure out what your next steps are if things haven't quite worked out with the NHS so far, please do get in touch. Our number and email are above and below. And you can also read all of our information on our website if you'd like to find out more for yourself. And any questions, you can always contact us for that as well. All right, thank you.